Okay, so now I've finished taking your clinical history, we're going to move on and record your 12-lead ECG. As I explained to you before, it is totally painless and it involves you popping onto the couch over there. Have you ever had one before?
No.
Okay, so what we're going to do is use some little sticky electrodes to place onto your wrists, onto your ankles and across your chest, and it allows me to record the electrical activity of your heart and also looks at the rate and the rhythm. Is that okay?
Yes.
Once you've gained consent to record the 12-lead ECG, you need to pay particular attention to patients' privacy and dignity. Try to record the ECG in a secure area where you're unlikely to be disturbed. You need to do this in a comfortable area where your patient is relaxed. The more relaxed your patient is, the less likely you are to have a muscle tremor, which can interfere with the recording. Are you comfortable there?
Yes.
Make sure you explain what you're going to do before you do it. What it aims to show, what's the purpose of recording the ECG. Reassure your patient that it's a painless procedure and also let them know when they're likely to get the results back. Try to have all your equipment ready before you go to the patient to not have them exposed for too long. And also pay attention to ensuring your hands are clean. I have washed my hands before we start. 12-lead ECG machines vary from one manufacturer to another, so you need to be familiar with the equipment you're using before you use it. Today I'll be using the Philips TC50. The lead placement doesn't change from one machine to another, and it's essential to make sure the leads are in the right place and have good contact to get a good recording of the ECG itself. Let's start with the limb leads. Lay the wires on the patient and make sure they are not twisted. Ensure the electrodes you're using are in date. If you're using wet gel electrodes, you don't need to prepare the skin. If they are dry electrodes, you may need to remove oil from the skin with an alcohol wipe, or use some gauze to remove dry skin cells for better contact. You may need to shave just the area where the electrodes are to be placed. Place the electrodes on the inner aspects of the wrists and ankles and attach the leads. Okay, can I ask you just to rotate your arms around for me? I'm just going to pop these on your wrist there as well. The limb leads can be moved further along the limb if required, for example if your patient is an amputee or has a muscle tremor, but make sure you keep the leads off the torso itself. That was the limb leads. Now for the chest leads, sometimes known as the V leads. You must pay particular attention to placing these accurately. V1. This is placed on the fourth intercostal space, just to the right of the sternum. There are several different ways of finding this landmark. You could count down from the right clavicle through each intercostal space to the fourth, but the gap between the clavicle and the first rib is not the first intercostal space, so be careful. Another way is to use the sternal notch, or the angle of Lois, to find the second intercostal space. The sternal notch is the junction of the manubrium and the main body of the sternum. Slide your fingers to the right. This is the second rib, and the indentation below is the second intercostal space. Palpate down to find the third and then the fourth. You okay there? Yeah. V2 is the fourth intercostal space just to the left of the sternum. V3 is placed between V2 and V4, so it's sometimes useful to place V4 first. This goes on the 5th intercostal space in the mid-clavicular line. And then V3 in between. V5 is placed on the mid-clavicular line on the same horizontal line as V4. And finally V6 on the mid-axillary line on the same horizontal line as V4 and V5. You then need to attach the leads to the electrodes. You still alright there?
Yeah.
Wonderful. Not too much longer now. Okay, we're going to take the ECG recording now. Just lay nice and still for me. Just taking the recording. And breathe away normally. Well, looking at this, it all looks fine to me. We'll get the doctor to have a look at it and we'll be in touch very soon with the results. I'm going to take the leads off now.